Welcome to the Healthcare Revolution podcast, where we empower you to take control of your health, restore your trust in the medical system, and achieve lasting wellness. Each episode, we dive into all things rehab prevention, overall health, bringing you expert insights from leaders across various healthcare fields. Please note, while we aim to provide you with the best knowledge and advice, the opinions shared represent those of the experts on this podcast and are not to be a replacement for professional medical advice. So let's revolutionize healthcare and wellness together. Today I have with us Annalee Scott, who is a doctor of physical therapy and an absolute expert guru in ACL rehab. She is a good friend and one of our clinic directors, and we're bringing her on to talk all things ACL in the rehab setting. And we might dive into some surgical approaches as well, but we want to talk about, let's just talk about ACL. What is an ACL?
ACL is...
And welcome, by the way.
Thank you. The ACL is one of your ligaments in the knee that provides stability. It stands for anterior cruciate ligament.
Tell me why you're so passionate about this area. What started all this?
When I was in high school, I played basketball, and one of my best friends that I played basketball with, she tore her ACL, and ended up being one of those cases where she tore multiple times. She's torn both knees. One of her knees was torn a couple times, and then...
She had couple ACL tears?
She had multiple, so end of junior year, end of senior year, I don't remember the details. She's torn 3 or 4 times total. Yeah, so watching her go through that was actually my first exposure to physical therapy. Yeah. That was the first time I set foot in a clinic was when I went to one of her rehab sessions. And just saw the...
And looking back now, I'm sure you're like, why? Why in the world did we do that 3 to 4 times? Like, This shouldn't even be a one-time thing, much less a second, a third, and a fourth, you know?
Yeah, it was devastating. And so I have grown to love... I've always loved sports, and that's a really common injury in the sports I played with basketball and soccer. And so I just really want to try to prevent that from happening from anyone else because it was terrible.
Yeah, tell me about what are the most common reasons for tearing your ACL?
The most common mechanism of tearing your ACL can come from when you are landing with poor mechanics, when your knee is going through a rotational force, too much inward motion. It's also called valgus. Have you ever heard of that?
So knees just kind of caves in. You lack control at the knee and it caves into goes to the inside.
Yeah. That can happen whether there is contact involved with your sport. It can also, I've had some patients that tore her ACL from getting out of a truck. She just
what
dropped wrong.
What percentage roughly come from contact versus non-contact?
Yes, maybe 40% are non-contact. I have no idea.
Yeah, it's a huge percent. A lot of people think that you got to get hit from the side or a blow to the knee, but there's a huge percentage that just from happening from twisting or landing wrong or deceleration or turn, there's a lot of different ways to tear your ACL.
Sometimes it doesn't take much. A lot of times just from one of my patients tore from just doing a simple vertical jump. She was testing her vertical jump. She is also, I hadn't treated her for any of her previous injuries. This was her 4th re-tear and she's only 18.
Yeah. Oh man. Can't imagine.
Yeah.
That is such a hard injury. What's the average time frame in which someone is recovering from an ACL?
Recovery can take 9 months to a year to 18 months in some complex cases.
So you think 9 months, you do it 4 times, that's almost 4 years of your life that you're in seeing a physical therapist.
Yeah, it's a lot of rehab.
Tell me about 9 months. How often do you see people in that 9-month period? How does that look?
So I always try to make sure I'm seeing someone at least through 9 months, and we'll go longer if they're not passing the criteria that I want to see.
Oh, I love that you talk about criteria. We'll dive into that. Keep going.
Yeah. It can be tricky in the insurance world, making sure that you are able to see someone throughout that plan of care, but from what I see and what I hear from patients who do re-tear, they often stop their rehab at 4 months, 6 months, 7 months, and they're just given no guidance of how to progress forward, how to return to sport. Some were cleared to return to sport before, at the 7-month mark, and they ended up back in the clinic.
Okay,
so that's unfortunate.
I think this is the most important part of this podcast. Tell me about the criteria-based measuring that you do in the clinic to know someone's ready to return to sport. It's so easy to say, yeah, you look right, or yeah, it looks good. It's been 3 months. But what is the criteria that you use in the clinic? And I know there's a lot. Just kind of give us a brief scenario about what you measure.
I'd say one of the most important things that we try to get is objective strength information. Gold standard is going to be the fancy Biodex machine. Most people don't have access to that, but some way of getting a number, an objective number for their strength output for their quads and their hamstrings is absolutely vital. I've seen patients that have come in, I ask them about their rehab experience in past and what their strength numbers look like, and most of them are only tested with kind of like a feel on the hand of they kick into the therapist's hands and they kind of gauge the strength in that way. And one guy came in a year post-op and we tested his strength because he was having some other knee pain, and he ended up having a quad to hamstring ratio of 30% after 1 year of rehab.
What's normal?
And we want a minimum of 60. I like to see 70% in my ACL patients.
So hamstring to quad ratio.
Yeah.
Around 60 to 70%. Yeah, absolutely. What do you want your quad ratio to be? So if I measured my right knee extension, my quad strength versus my left, what do you want that to see?
I want to see minimum of 90, but I like to see as symmetrical as possible.
Yeah, up to 100%. Yeah. I love it. So if someone's sitting at 70%, are they ready to return to sport?
Not at all.
Yeah, what tools do you use to determine those numbers?
So in our clinic, we use a isometric dynamometer testing setup using the tool called the Tyndec. We just have the system set up so everything is very specific and replicable to get as consistent data so we can make those good decisions with it as possible.
Great. So it's a machine or a Bluetooth device that you use that maybe attaches to your phone, or a device that tells you how many pounds of pressure they can produce. And they're sitting on a chair, pushing into a chain, something that's not moving, and it gives them a force output.
Yeah.
I love that because it's very objective.
It's
We're
getting numbers.
You either passed or you failed. It's not just like, oh yeah, it feels about the same. Right? It's very objective. Tell me about some of the other tests.
So that's strength, and then we look at control with power and landing mechanics. So we do hop testing, various versions of hop testing to look at how well an athlete can produce force as well as stabilize on the landing and making sure that they can do that well. We want to make sure that we're doing that when they're rested and as well as under fatigue, because we are in the sport world where we have to be able to demonstrate good mechanics throughout the whole game. We can't just do it while we're fresh.
Yeah.
We also
you'll fatigue people in the clinic. You'll test them for power in the beginning, see how what the quality looks like, measure maybe distance between your right leg and your left leg that you cover, and then you'll fatigue them and then do it again.
Yep.
I love that.
And then I think another huge piece that gets missed is psychological readiness. So there's 2 questionnaires that I have patients fill out where they give answers as to their confidence level and how confident they feel in returning to sport and activity. And that helps me know where they're at mentally, which is a huge piece of ACL rehab. I love that. So
that's a questionnaire that you give them that helps you know where they're at. What do you do to influence that if you see a low score?
If I see a low score, I ask follow-up questions to know like what the concerns are, where they feel the lack of confidence is coming from, and then we train that specifically in the clinic, give them drills to work on that.
Give me an example of 1 or 2 things that you might see on that, and then how you work on it in the clinic.
Some of them are just general, like how confident are you in returning to sport without re-injury? And if they lack confidence in that, then I'll ask follow-up questions like, what part of your sport do you not feel confident in? Is it the cutting? Is it the skill? Is it just the fear, not feeling strength? Do you feel like it's weak still? Trying to get the specifics, and then I can give them more specifics based off of that.
So a question might be, how confident are you with jumping? And then you work on jumping, right?
Yeah.
So it's very specific. I love with ACL rehab, the specificity matters. So many of us are like, let's just put you through a general program, right? And the purpose of this podcast is to improve the healthcare experience, right? And we want to reduce and completely abolish the likelihood of having re-tears. It is such a terrible thing to go through. 9 months rehab, that is just so brutal, mentally, physically, emotionally, psychologically. It's just so hard. Why would you want to do it again?
Yeah.
Right? And this criteria we have is very scientific to show you are ready.
Yeah.
And what happens to an athlete if they're not confident? Say they hit all the criteria, but they just lack confidence with going back to their sport. Are they likely to re-tear again? Is there confidence?
Based off of opinion or research, based off my opinion, I could see that being related to re-tear because you are not going to move confidently, and how you move is ultimately going to
Is your confidence tied to your power?
health.
Is your confidence tied to your endurance, right? If you lack confidence, you're not going to go into contact with full force. You're going to go in with hesitation. You are definitely likely to re-tear if you don't have 100% confidence in that area. So this criteria that we put athletes through is really helpful because it gives them more confidence.
Yeah.
And they're like, oh, I passed the test, right?
Absolutely.
And it's literally, we have a document that's like pass or fail, right? And you go through and you're like, passed, failed. We need to work on that. And it helps us isolate and say, yeah, we need to keep targeting those things. So I love that. Any other thoughts on the criteria? Any things that you like? Like how does this really help you as a PT determine if someone's ready for sport?
I think the other thing that comes with those criteria is not only like, so when we're looking at hop testing or some of our functional tests, we want to not just look at like the distance that they move, but also their movement quality. I had a really interesting case where we did the strength testing and the girl tested like symmetrical. She would have passed her strength testing, but then I had her do this specific drill that helped me know if she was able to load her knee and use her quad through specific range of motion, like can she use her quad functionally? And it was a complete fail. She was 100% using more of her glutes and her hips, not able to use her knee and load her knee and quads that way.
So that
was
easy
really
for
insightful.
someone like a personal trainer to pick up?
No.
Why?
Not at all. Level of training, I would guess. It's not even something that I feel like I was trained specifically on in general PT school. I feel like it was little details of movement that I'm looking for as I've tried to grow into the area of ACL rehab.
They're trying to, a lot of technology is emerging, is recording people, and it's breaking down biomechanics, right? It's essentially taking the PT's job over. How do you feel about these AI devices that are recording and detecting those little things? What value do you see those in the clinic?
I think that there's some interesting application to them. I don't think that there will ever be anything that can replace the human eye as far as what PTs are trained in, but I think that it can be helpful to catch some things that we might not see, can be helpful to reinforce things that we see.
Absolutely. I love using in the clinic slow motion capture, or I'll just film a video of someone on the treadmill and I'll slow it down and just break down the gait process, right? And you identify things when you can slow it down and speed it up, real time versus slow time, and it's so helpful to catch the eye, because a lot of times you can see it as a PT, but you have to train your eye. Like how many years, how much effort have you put into training your eyes to see movements?
Years, 100%. For the years I've been out of school, it's a continual practice. I like to see random videos on Instagram and pick out movements and just train myself and test myself and see the flaws of movement, because the better I can do that, the better I can help my athletes.
Yeah. We had a gait analysis therapist teach us in school, and he took away our phones and he said, you got to see it. Force yourself to learn real time. And it really helped us master the visual aspect of biomechanics. How do you is it leaning too far forward versus trunk up? How does that influence quad and glute control, right? How does that influence how power is created? And it's so crazy how much just a slight angle and changes in movement really can affect a lot of things down the chain.
Absolutely.
So lastly, let's just talk about preventative measures. How does someone prevent from having an ACL injury in the first place?
One of the biggest areas I see need, especially in high school athletes, is just really good strength training program. The stronger you are, the better things are going to be for you as an athlete. And there used to be like concerns about teenagers getting under weights and doing lifting, but that has all been debunked. That's totally safe. Under supervision
is it okay for
is
young
best.
kids to lift weights?
Absolutely. The recommended
Does it stunt growth?
No, not at all. Supervision is recommended though, if they're new to it, learning the movement well. But then the good solid progression into heavy strength training is going to be super beneficial. And then there's lots of programs that have been studied and developed where they've just looked at simple things that you can add into a warm-up. So if you're like a coach, you can learn these programs to have your athletes warm up with, and they've been shown to have reduction in rates of injuries to the knee and the lower,
so there's
in the lower body.
programs that have been created to reduce the likelihood of tearing.
Yeah.
That's awesome. And how do high school coaches and things get access to these types of things? What resources do we have for the community that can, look at these preventative programs?
I've found some, like, I know if you just do a Google search that the big names will pop up. So FIFA, it used to be called FIFA 11. That was like the old name. I don't remember the current name. It's
So
like
if
stuck in
someone
my
Googled
brain.
ACL prevention program, they'd come up with quite a few.
Yeah, they would find a few options.
Awesome.
And there's lots of different versions. There's some that are more routines that you do outside of practice, and there's some that are the things that you throw in the warm-up. So
How
you
many
can find what you need.
athletes roughly do you feel like are underdeveloped? Is it a huge percentage? Like are young athletes at high risk for ACL injuries, in your opinion?
Absolutely. I would say most high school girls, especially, that's kind of the population that I work with a lot. Most high school girls.
Why females over males?
Like, why are they at high risk?
Mm-hmm.
They are set up that way just based off of kind of some of their anatomy and the angles of which their legs come out of their hips kind of sets them up for more of a torque at their knee.
So wider hips, the more likely you are to tear. Is that what I'm hearing?
It seems to be one of the risk factors, yes.
Yeah. It's wild how that influences. But yeah, so you're saying a lot of our athletes are underdeveloped and are at risk for ACL tears.
Yes. I remember when I was in high school, there was very little guidance as far as how to develop strength as an athlete. Especially, like, I was even in a weights class, and there was little guidance given to us as far as a progressive program compared to some of the athletes in other sports there. And I think that there's a part of it where coaches undervalue it and underutilize it, and so they're not investing as much time and energy into helping their athletes achieve that. But I also have heard of coaches where they take it on themselves and they do help their athletes go through strength training. They open up their homes and they have them come lift with them, and I think that's super fun. So it's growing. There's more gyms that are opening geared towards teen athletes, and I think that's awesome, and that's going to be a valuable resource for athletes.
Two last things. How are you building the bridge with personal trainers, coaches, surgeons? Tell me about that aspect a little bit. Like, what's your involvement there?
I like to keep in close communication with surgeons. So I'll start with surgeons first. So I like to know who the surgeons are. I know it's a long recovery. I want them to know that I'm involved with the patient, and I'll give them updates regularly on anything that I see that's not going well or things that even are going well, just preparing them for their follow-up visits. So I like to keep close tabs with surgeons so that I can let them know if something's not going right that I see in their rehab. We're not set up to allow for regular encounters with our patients 3 times a week for the 9 months. That's just not realistic.
Yeah.
And so finding places that they can train on their own if they are comfortable.
If someone had to be with me 3 times a week for 9 weeks or 9 months.
Yeah, that'd be rough. So finding.
I like to think I'm fun, but not that fun.
Yeah, that'd be a lot. So yeah, finding those resources for them to be able to transition to as we wean down. I'm not like saying goodbye to them. I'm still seeing them regularly. And if things are not improving, then I will see them more frequently. But having personal trainers that understand a little bit behind the surgery and having gyms that have some of those programs built in place is super helpful. And connecting with those has been really valuable.
And I know you work a lot with gyms and building these programs and teaching personal trainers that we have to do that, right? You take it to the rehab level, and then the next level, let's get you with a good trainer that just takes you over the top. But just kind of summarizing today, you need a team. Right? You can prevent. Our young athletes are at risk, a lot of them, because they're underdeveloped. We got to have good training programs for them. If you do tear, we have great resources, but you do need a team. And it is a process, and you don't want to re-tear again. But there is criteria that demonstrates, like, it is tried and true, clear, that if you get this criteria, your re-tear rate is significantly lower. 9 months is one of those. You hit the 9-month mark. It's not 8 months and a half, right?
Yeah.
You hit that 9-month mark, and it's a time period. But then you also have the other, agility type work, the strength type work. Lastly, what would you like to see happen in the medical system to improve in this field?
I just want to emphasize the 9 months real quick. 50% is the number. 50% reduced risk of re-injury if you return after 9 months.
Huge.
So that's a huge number that I never clear anyone before 9 months, but I will present the information, and if they feel ready, that's their choice. But I personally do not clear athletes.
Yeah, you still fail them, right?
Yeah. I think that it's such a big case of rehab. I would like there to be a way for patients to be able to find really qualified providers that can direct their rehab, because there's so much to cover that they just can't cover that in PT school.
Yeah.
It needs to require extra time spent outside of school to really get into some of the specifics in order to do it really well. And so it'd be great if there was a system that patients had the ability to look up some of those experts in the area so that they can be really set up for success.
Yeah, most PTs say they'll treat ACLs, but are they prepared? Are they competent to be able to treat those high level or just ACLs in general?
Yeah.
Right? It's a complex condition, and we need to make sure they're competent to be able to treat that. Well, thank you for joining us today, Annalee. Pleasure to have you on the show. We appreciate you what you do for the community.
Thank you. Thank you for having me. It's been fun.